Hi, ladies, it's Dr. Scherbel, and it's Breast Cancer Awareness Month, and that is a very, very important topic in my field, in my daily practice. I talk about breast cancer to basically every patient, every time I see them, and we're trying to identify risk factors and things that could put somebody at increased risk for it. So I thought I'd use this as an opportunity to kind of talk to you guys briefly about breast cancer and different things to consider that you could talk to your doctor about. So firstly, something that comes up actually is screening. When do we start doing mammograms is the classic screening modality. So for years and years and years, it was always started at age 40. About 10 years ago, the government had their own kind of task force look into it, and they said the government recommendations were that we could start general screening on a general population if you don't have any increased risk at age 50. But the American College of OBGYNs, which are the governing body for OBGYNs, still supports doing screening mammograms at 40. What is a mammogram? A mammogram is that they're going to squeeze the breast tissue. The rumors are true. They squeeze your breast tissue and they take x-rays. So a mammogram is x-rays through the breast tissue. But we have these conflicting guidelines. So if a patient does not have a personal or strong family history of breast cancer and she doesn't want mammograms, I let her start at age 50, and instead of doing them every year, we can space them out to every other year. But my preference is that a woman gets a mammogram every year, start at age 40 at minimum. Family history and personal history makes a big difference with all of this. So I spend a lot of time talking to my patients about a way that we can decide if they have an increased risk. They might say, well, my aunt had breast cancer and my cousin, and I don't know if that puts me at an increased risk or not. So we're always trying to figure out their risk factors. So there's something called the Thyroid-Cuzick score, and I'm going to show it to you guys so you can Google it. Okay, it's backwards, but okay, my doctor handwriting. Okay, Tyrer, Tyrer dash Cuzick, Cusick. But the Thyroid-Cuzick score is a series of about 8 or 9 questions that you answer about your personal and family history, and you click enter. It tells you your risk of developing breast cancer. So it's a good starting point if we're trying to treat somebody and we don't know how concerned to be about them. Most women get mammograms once a year. The general population risk for breast cancer is 1 in 8 women. That's also 12%. So that's a good starting point too. 1 in 8 women in our country are going to get breast cancer. If you want to know if you're at an increased risk of breast cancer, you should go online and look at the Thyroid-Cuzick score, Tyrer-Cuzick, Cusick, to see if it's an increased risk. If your risk falls above 20%, increased risk of 20% of breast cancer throughout your lifetime, it's recommended that you get MRIs and mammograms alternating every 6 months. If your risk is 15% or greater, then it's recommended that you get ultrasounds and mammograms every 6 months. And then if your risk is less than 15%, it's recommended just to get a mammogram once a year. So that is the Thyroid-Cuzick score, and that is how I determine who to screen more frequently and how I counsel that patient differently. So I wanted to mention that the other things that have come up recently in modern medicine is we have new genes that we can identify. So they're old genes, but we've new technology that can identify genes that put you at increased risk of breast cancer. So the classic one that you guys might have heard of before is the BRCA mutation, BRCA. And BRCA is really aggressive. And if you have this genetic mutation, there's a 90% chance, depending on which gene it is, a 90% chance of having breast cancer and a up to 40% chance of having ovarian cancer. So everyone knows about the BRCA gene, BRCA1. A lot of people have heard of that, but the truth is there's a lot of genes that can identify an increased risk of breast cancer. So I learn new genes all the time just by getting the genetic testing, and then I learned about a new gene that a patient had. So genetics is new in our field in the past maybe 15 or 20 years, and it's really exciting. So if there is a personal or family history of breast cancer, I highly recommend genetic testing. I offer it every day. I draw them every day to see if we can find a gene that's in your family that puts you at increased risk of breast cancer. then I can counsel the patient better on what to do next. So considerations that come up with that is I would tell a young woman who doesn't have her life insurance policy not to get genetic testing, because they might not give you life insurance if they know that you have a 90% chance of breast cancer. So I often, unfortunately, have to have that conversation with patients. That really upsets me, because really I just want them to be healthy, and that's my biggest aim. But you want to consider, before you get genetic testing, have all your life insurance set up before you get it done. And so I'll tell women who are older that even if they're not concerned, they might want to do that for their daughters, because maybe their daughters are too little for life insurance. So it's just something to think about when you're going to get genetic testing. The other thing about genetic testing is we keep coming up with new genes, because we have these huge databases now where more and more genes are added as we collect more data. So every 10 years, we should redo that genetic testing if there's a personal or family history, to see if there's a new gene that's been discovered in the past 10 years, which oftentimes there is. I want to make a few points about environmental causes. So I've been talking about genetic causes for breast cancer, but there's a few environmental causes I want to mention. You hear lots of things on the internet, like breastfeeding your baby is protective against breast cancer, or being pregnant, and all these things. But what it all comes down to is basically, the longer you lactate, the less hormone exposure your breast tissue has. So the theory is that then there's less risk of breast cancer. But I've seen lots of women who've had many babies and breastfed all of them get breast cancer. So I don't think any of my colleagues really alter our management or risk based on a history like that. Two things that come up I want to mention, though. One is that, of course, if you watch my videos, I'm a hormone expert. I'm really passionate about hormone therapy. The Women's Health Initiative was this big study that came out in 2002 that made us all afraid of hormones and made us all afraid that hormones are going to cause breast cancer, and they don't. So bioidentical hormones, which I'm saying hormones that look exactly the same as the hormones your body makes, reduce the risk of breast cancer. There was recently, just in June of 2025, the NIH came out with a new study where they had 460,000 women in the study, and they found that women who take just bioidentical estrogen had a significant reduction in their breast cancer risk. There is concern that if you take a synthetic progestin, not progesterone, but a synthetic progestin, which means a synthetic molecule, with the estrogen, that could very slightly increase your chance of breast cancer, which is why when I'm practicing perimenopause and hormone replacement therapy, we use natural bioidentical progesterone. We never use synthetic progestins. But the women in this newest NIH study who took just the bioidentical estrogen had a significant reduction in their breast cancer risk. One thing that's really unpleasant, on top of an unpleasant topic to mention, though, that I feel that needs to be discussed at length, is alcohol exposure. So it's been coming out in the past few years that exposure to alcohol or chronic alcohol use, even in a little bit, significantly increases the risk of breast cancer. And that is something that is difficult for me to talk about because drinking alcohol is a big part of American culture. I mean, when we get together with our friends, we get together with our family, we go out to parties. Basically, Americans drink a lot of alcohol. And maybe that's been contributing to our high rates of breast cancer. In fact, we know that. So I don't want to dice words. The more alcohol you drink, the higher the risk of breast cancer. And if you've never heard that before, I understand. I only heard this a few years ago. I thought it was shocking when I heard it too. But do yourself a favor and look into it. Alcohol is extremely inflammatory and very, very bad for your body. And I think as a policy, we should all try to drink a little bit less. There's no judgment here, but I think we should all try to drink a little bit less, but it will certainly reduce our breast cancer risk to reduce our alcohol intake. And breast cancer is a very upsetting thing. All women are at risk for it, and 1 in 8 women are going to get it, which is why it's talked about so much. So I think it's good that we're having this conversation, and we should make sure to get our screening mammograms and stay ahead of it. And I have some patients with breast cancer. Maybe they're watching it now, and I'm thinking of you. My grandmother had it. My dad's mother had it, and I never really knew her. She passed when I was tiny, when I was 3 years old, from recurrence of breast cancer that she initially got in her early 50s. So I don't take it flippantly. It's a really serious topic. I'm protecting myself by not drinking alcohol and taking hormones and getting my screening mammograms and getting my genetic testing done. That's what I've chosen to do with my family history. So thanks for listening in. I'm sorry this took a little bit longer, but it's kind of a big topic. And if you have any particular topics you want me to talk about, you could just send a message on this link and I'm happy to get to it. I'm Dr. Scherbel. I work at Scherbel Clinic, and schedule your screening mammogram.